But good afternoon, everyone. You're all very, very welcome indeed. I'm Joan McEwen, the Associate Director for Policy and Public Affairs for Marie Curie in Northern Ireland, and I'm absolutely delighted to be hosting this spotlight session on compassionate schools, which will be looking at strengthening grief education and bereavement support in schools and the educational setting. So this session will really be looking at the important role that schools have to play in supporting bereaved pupils and young people. And in particular, we'll be looking at some of the work we've been doing in Northern Ireland. You can see the slide on the screen there. We've been doing an extensive body of work here in Northern Ireland. And then we will also be referring to an expert panel. I'm delighted that they're joining us today, and I will introduce you to them all very shortly. So by way of background, just to give you a bit of an indication of why we've been looking at compassionate schools and what we've been doing here. Whilst we don't have robust data around young people and bereavement, we do know that it's estimated that most young people will be bereaved of someone close to them by the time they leave school. And we know that it's estimated in Northern Ireland around 1,600 young people every single year will be bereaved of at least one parent. And of course, in recent years, we've had the devastating impact of COVID as well, and as well as the excess deaths that have, as a society, we've experienced under very cruel circumstances. That has had an also devastating impact on bereavement, and we've seen over 16,000 excess bereavements in Northern Ireland here from that. We know that unresolved grief and bereavement among young people can also have a lasting impact and a very negative impact for them as well. We know that they're more likely to be excluded from school, they're more likely to have been impacted by mental ill health, and we know that over 40% of young offenders have been bereaved as a young person as well. So it's against that backdrop that we really are very passionate around creating compassionate schools and about the work that we've been doing in Northern Ireland. And we really see that our schools environment is a home for many young people. And we want to share that experience and learn from other areas as well. So we may be having difficulties technically this morning and this afternoon, and Christine Irvine, who I work closely with, has been doing a huge amount of work on our school bereavement programme. I'm hoping to hand over to her shortly. If that doesn't happen, then I'm very happy to step in and share her slides and do that presentation. But I just want to also mention our panel of experts that we have with us this afternoon. We're very lucky to have them and very grateful to them for joining us. They're all very busy people. We have, first of all, we have Gail Precious, who is the programme lead from the Child Bereavement Network. We have Dr. Sally Paul, who is from Strathclyde University and co-founder of the European Learning Network on Compassionate Schools. We have Jackie White, who not only is a teacher of many years with extensive experience as a teacher, she's chairperson of the Northern Ireland Teaching Council, and we have Nick Matheson, an Alliance MLA, and who is also chairperson of the Northern Ireland Assembly Education Committee. So I am going to hand over to Christine now, who can hopefully access her screen and be able to start presenting on the findings from our school bereavement programme in Northern Ireland. Over to you, Christine. So I think Christine is still having problems, so I am going to present on her behalf. Is that okay?
Asked her to unmute and speak, so let's see if this works.
Okay. Are you able to unmute, Christine?
Let me try and unmute her.
Really sorry about this. So you want me to start speaking now? I can't hear a thing, but if you can hear me, that's great. Joan, you're okay to go?
Yes.
Okay, thank you. Sorry, this is a bit different. So hello everybody, my name's Christine and I'm Senior Policy Manager at Curie. I'm really pleased to be here to be part of the Spotlight session. And as an opener, I'm going to provide you with an overview of the Marie Curie Schools Bereavement Programme, talk a wee bit about its focus and some of the learning, and that'll lead us into the panel session. So between 2020 and 2024, Marie Curie undertook a significant body of work through our Schools Bereavement Programme to consider the role of educational settings in offering grief education and bereavement support in schools. We gathered extensive evidence from 3 phases of work. We piloted and evaluated bereavement training for teachers. We commissioned research with the public and young people to better understand their experiences of bereavement support in schools and also their attitudes towards grief education. In addition to this, we carried out extensive stakeholder engagement to consider the findings in the context of what was already in place in Northern Ireland and to formulate recommendations on how our culture, policy and practice could be strengthened. In the way of background to the Northern Ireland policy landscape, neither teacher training or bereavement policy is mandatory for schools in Northern Ireland, and grief education is not explicitly mentioned, although it is covered as part of broader personal development learning outcomes such as feelings and emotions and managing change. The programme findings that we're talking about today were launched on the 20th of November last year in our report, Compassionate School Communities, Embedding a Culture and Practice of Grief Education and Bereavement Support in Educational Settings. In the short time that I have this afternoon, I can only give you a taster of what was in that final report. There's also a link provided in the chat box if you're interested in looking at the report in more detail after this session. So I'm going to talk you through a few of the key findings across the main phases of the work and end with an overview of the recommendations the report has made. If you could just move on to the next slide, please. So teacher training was delivered in partnership with Curie, and the materials were developed by an independent counsellor who specialises in child bereavement. During August 22 and August 23, face-to-face interactive training was provided to just under 400 teachers across primary and post-primary schools in Northern Ireland. And you can see in the slide the breakdown of the schools involved. A pre and post evaluation methodology was used, which found a significant increase in teachers' move to the next slide, sorry. A pre and post evaluation methodology which was used and found a significant increase in teachers' confidence and knowledge in being able to identify and approach a bereaved pupil. Further to confidence to be able to ask a young person themselves that what they wanted, what help they needed, and to know where to go to find more useful tools and resources. Slide 5, please. During the engagement exercise, we found very low awareness of a bereavement policy by either teachers or pupils. In fact, at least 3/4 of the respondents that engaged with our programme had been unaware of whether their school had one. But interestingly, we found that the teacher training had a real impact on the attention a bereavement policy was given in the school, where a teacher picked this issue up with their colleagues when they returned. During the post-evaluation surveys, teachers informed us that the training had prompted the development of a bereavement policy in some cases, encouraged them to review what they had if something was already in place, and in some places it led to the creation of a separate policy where bereavement was covered as part of a broader framework. Next slide, please. I'm just going to move on now to the work that we did to better understand public and parent views of grief education and bereavement support in school. And some of you may already have heard about the findings from the Paddock survey. This is a UK-wide adult survey on public attitudes to death and dying, which Marie Curie has commissioned to Cardiff University over a number of years. In the most recent 2023 survey, for the first time, there was a module of questions on public attitudes to bereavement support and grief education, and a subgroup of that sample included parents, including parents of bereaved children. Next slide, please. And I've just pulled out one question from that survey for today, but there's much more in the main report, including a link to a wider UK report which shows the results for these questions for other parts of the UK. People were given a range of statements, and this graph I'm showing you now, people were given you a range of statements around the perceived benefits of learning about grief and bereavement at school, and they were asked if they agreed or disagreed to a number of statements. This bar graph shows the Northern Ireland results for this question broken down by primary and secondary school. So parents were asked, or the adults were asked about their views to these statements for both primary age and secondary age pupils. The blue line is the percentage of the public that agreed that there were benefits. And you can see across all of the statements, the majority are the proportion of blue is more than any other colour, which shows in the main there was support for these statements. Both parents and the public were broadly supportive of grief education being included in the curriculum, especially for post-primary and for older primary sector aged children, those aged between probably 8 and 11. So if you move on, please. Finally, we also gathered the views of just over 1,000 young people by commissioning a module of questions in the Young Life and Times. This is an annual survey with 16-year-olds. And in the most recent survey, we commissioned a module of questions asking young people about their views of grief education and bereavement support. And this survey, just as a general point, this survey has gathered the views and attitudes from young people on issues affecting them for over 20 years. And this is the first time grief has been included. And we're very proud that Marie Curie was the organisation that instigated that. Next slide, please. There were five or six questions included in the module within that survey, and I just wanted to highlight a few for the purposes of today. So in this first graph, you'll see this was the question asked of young people about how easy or difficult they found it to talk about bereavement, and also the perception of how hard or easy it was for others. And the results showed that young people perceived themselves to be more comfortable talking about bereavement than they perceived others to be. If you look at the hard or very hard bar graphs on the far side, you'll see that it tells us that 46 of young people surveyed said that they found it hard or very hard to talk about bereavement, but this compared to 79% for other people. Additionally, I haven't added the graphs here, but we found that 80% of the young people surveyed were supportive of grief education in schools, and 90% were supportive of bereavement support in schools. So a real mandate there for doing more in terms of school policy around bereavement. Next slide, please. The Marie Curie team has engaged extensively with a wide range of stakeholders during the life of the programme, and some of the key ones are noted on the slide here. There was a programme board which advised and supported the programme at all stages, and this included a youth advisory subgroup. Other stakeholders included teachers, trade unions, and those working both in education and in the public health space. And we've been very, very pleased with the fact that we have drawn in those who work in public health as well as those that work in education. Next slide, please. We're also really pleased with the endorsement for this report and its recommendations by the Education Minister. He both wrote the foreword and also met with staff from Marie Curie in advance of the launch of the report. And we have also spoken to the Education Committee since launching the report. And we're very pleased that you're going to hear from actually some of those key experts and supporters of our compassionate school communities in the panel session following this presentation. Just move on to the next slide, please. So on the back of all the significant body of evidence that we've gathered that I've just kind of did a whistle-stop tour through, I just wanted to highlight some of what I'm going to just highlight some of the critical issues that we also gathered as part of this work, and then I'm going to finish by setting out 5 overarching recommendations that have been made. So firstly, children and young people's wellbeing voice needs to be prioritised. There was a clear message from young people that they want schools to do more. They also told us that they want to have an active role in developing policy and resource in their schools. They just don't want it to be developed for them. They want to be actively involved in informing and shaping school policy and practice. Parents are also generally supportive. However, parents underscored this support with an emphasis on teachers being fully trained and schools being prepared. The importance of having a strong school policy and practice framework was also raised by stakeholders, and this led to a conversation about the need for leadership and collaboration and embedding supportive practices in school policies. Lastly, of course, we know schools aren't acting in a bubble and stigma around talking about grief and education does mirror wider community and cultural norms, which is why breaking the taboo and wider cultural change was included as an equally critical issue to be mindful of when trying to generate change. And just onto my last slide now. So Marie Curie has made 5 overarching recommendations. These won't come as a surprise to those already familiar with this area of work, as these are calls that have been made across many countries of the world now. There's an incredible international movement around creating compassionate school communities, and we're very proud to be part of this movement now in Northern Ireland and to have our own really strong supporter base and evidence to draw on. In the main report, our high-level recommendations are supplemented by a number of sub-recommendations which indicate some of the more practical steps that can be taken to achieve these. And I'm going to attempt to summarise these here. But I'd also, as I said at the beginning, refer you to the full report for much further detail, because I can't do it justice today. So the first recommendation is around strengthening education policy guidance and support. Marie Curie has recommended that bereavement and grief should be more explicitly referenced in education policy and guidance, with signposting to support materials more readily available to schools. We have recommended that information systems should be embedded in schools, which record the names of pupils who have been bereaved, who are expected to be bereaved due to a terminal illness. This will allow key information to be passported with young people, such as the relationship to the person that has died, and important days such as anniversary and birthdays. This will allow children and their parents to have much more confidence that their school really understands the holistic needs of their child and what needs to be in place to ensure that they're ready to learn. Recommendation 2 is around every school having a bereavement policy. We recommend that every school should be required to have a bereavement policy, that pupils are encouraged to be part of its development or review, and that every school should have a dedicated staff member to act as a bereavement coordinator to support its implementation. Recommendation 3 is that all teaching staff should have a range of opportunities to receive bereavement training. Marie Curie recommends that all teachers should receive basic awareness training as a part of their initial teacher training. We also recommend that bereavement and loss should be more explicitly referenced within teacher professional competencies and teacher continued professional development programs. Recommendation 4 is to ensure the education curriculum offers a range of opportunities for pupils to discuss bereavement and grief. Marie Curie recommends that bereavement and loss should be explicitly referenced within older primary and secondary school curriculum, as well as within the school's pastoral support programme. We have also emphasised in the report that the personal development curriculum is one of a number of ways that the subject can be broached with young people, and that opportunities should also be identified across the wider school timetable, such as core subjects, drama, science, English, literature, etc. And the last recommendation draws on the interest in this work that we've gained from both health and education. In this recommendation, we're recommendation that those links should be built on and strengthened, and where all opportunities are identified for that collaboration to continue. We know that Health and Social Care Trust school wellbeing and nursing teams are a valuable resource that is available to schools, and their expertise should be harnessed to support bereaved children. Further efforts should be made to develop partnerships with voluntary community organisations who have child bereavement expertise. Some schools do that. We want to make sure that all schools are thinking about that and getting support to do that well. Many schools already share resources and learning opportunities with others in their area as part of area learning groups, and we have said that there's value in considering how these learning networks could be used to further develop or strengthen compassion school practice. Whilst a minority view, the public attitude survey commissioned by Marie Curie did indicate a lack of understanding or underestimation of childhood bereavement and its impact. And this only came from a minority of adults, but it's an important issue that we feel could be addressed through wider public education. So I hope everyone found that helpful, and that will lead into a really useful panel session now. Just in the last slide, it's just to say that this is a really important area of work for Marie Curie in Northern Ireland. A huge amount of dedication and time has went into it, and a a really important network of support has been drawn around it. We will continue to share the findings where we can, and we're really pleased that we've been able to do that today with you. Hope you enjoy the rest of the session.
Thank you, Christine, and for running through that so comprehensively. As I said earlier, it was a very extensive body of work. It was a very collaborative piece of work. We involved a wide number of stakeholders right across education and public health as well. So we're very grateful to all of them as well for making it happen. And we launched the event last year as well, and it was a resounding success. It was a very interactive event, received a lot of media coverage, and we're really delighted to be part of this growing movement that's across these islands, UK and Ireland, and also wider as well. I would also just like to add that we are seeing lots of good practice on the back of the work as well. We're seeing lots of schools acting as champions in this area. There's a number of schools that are working up some great examples. And also we see that the Northern Trust are also developing a collaborative movement to embed compassionate schools. So already we can see that things are starting to happen on the ground. Before I move to our panel members, I just want to encourage everyone to please, if you have any questions, that's why we want these panel experts to make this an interactive session and how we really embed these compassionate communities. And if you have any questions, please put them in the chat, and I will be asking them shortly. I'll be putting your questions to them. But in advance of that, I want to go to our panel members and just ask them for their reflections and their views and feedback on how we together build awareness and support to nurture, create, embed the right culture, the right policy changes and practice in those educational settings that are needed to embed a compassionate community. So and for each of them to cover their respective areas. So I'm going to go first of all to Jackie White, who has many years experience as a teacher, but also with her voice of the teachers as a union rep as well, and as chairperson of the Teaching Council here. Just to give us a 5 minutes overview of your reflections, especially from that teaching perspective, Jackie.
Thank you very much, Joan. Thanks for that. I'm just starting a timer here in case, because once I start, I might not stop. You know what I'm like. Yes, as Joan said, my name is Jackie White. I'm General Secretary of the Ulster Teachers Union, but I'm Chair of the Northern Ireland Teachers Council. We've got 5 recognised teaching unions here in Northern Ireland for historical reasons. And therefore, I'm not just representing the views of my teaching members, it's right across the board. Some of those unions have been directly involved, including my own, with Joan and Christine in the work that's been going on. But certainly through the Northern Ireland Teachers Council, all of the unions here have bought into the whole desire to move this forward. Because, well, for a variety of reasons, we all know as teachers, and as Joan has mentioned, I was a teacher for 20 years myself. We know that the baseline for any kind of academic performance and any kind of improvement is the emotional health and well-being of those young people in our care. And this is just one element which, particularly in a society like ours, which is a post-conflict society and has come through COVID and all of those things, we see, particularly following COVID, actually, we see the huge impact that any kind of issue which impacts on the emotional well-being of those young people can actually bring to the table in terms of academic achievement. So we have an interest, and I think that interest has grown in making sure that we provide that base for those young people to sort of springboard off, if you like. We do have parts of the curriculum here in Northern Ireland where it would fit in nicely, where the grief education would fit in nicely. And some of them have been referenced, but we've got personal development and mutual understanding at our primary level. We've got relationships education. We've got learning for life and work, various things. And of course, these things can be addressed through literature and art and drama and so on. So we have a basis for it, and we have a certain opening for it. But we do have some issues around trying to move it forward on our own, if you like. The first of those, I suppose, is to do with the same as any public sector area at this moment in time. There's a real lack of funding. And I think the importance of the training of teachers has been really stressed through this report, because it increases the confidence of teachers. It positively impacts the wider culture, as has been referenced already. And those are really important things, because it's also referenced that handling things around grief and bereavement can actually cause distress if they're not dealt with in a proper fashion. So our teachers, they're very, very willing to move forward. And we have got a number of teachers, as has been referenced, who have taken the training and highly commend the training and have taken it back into their schools and have made an awful lot of difference through that. But then we have another raft of teachers who would be very keen to move forward, but have that concern that without the proper training, without the proper basis, without the proper support, that in ways they would do more harm than good. And I suppose in that context, we have schools that are more inclined towards bereavement support and doing something when the issue arises, as opposed to putting that for the baseline of the grief education in the first place. The other thing that the other issue, I suppose, that we face is we have a flexible curriculum, we have a skills-based curriculum, but then we also have a huge amount to fit in there. So we do need to have, because it's very flexible, it means that it's not mandated, and therefore, we maybe need to look at rebalancing that, because schools will choose to develop those skills through the pieces of that curriculum that they decide to move forward with. And that means they don't necessarily have a bereavement policy, a grief education policy, and so on. And we are glad that we have the minister's endorsement, but what we would actually have to have is a better framework. The schools themselves don't have the funding in order to release teachers to engage with the training. So the endorsement is a good baseline to start from, but then I think we need to work together, perhaps with the department, to look at building that into much more of a mainstream into we have very little in the way of professional development at this moment in time, but building that in and moving that forward on that basis.
Great.
Okay. Do you want me to stop there?
Would you mind, Jackie? I hate.
You know what I'm like, so just stop me.
I hate to cut you short, but I do want to give our other panel members a chance. But I wanted to get you in there because you have so much vital and rich information that we need to take on board. And I've written furiously some of your comments down. So Jackie, thank you so much.
No problem.
I want to go to Gail to ask you, Gail, from your learnings and what's happening in England, perhaps you would give us an insight into your approach and what's working from that perspective, because I know there's lots going on the consultation side of the house. If you wouldn't mind giving us 5 minutes from your perspective, that would be great.
Not a problem at all. And thank you so much for being here. I just want to stress I am not an expert in this, but I am just as committed and passionate about grief education as many of the people are here today, particularly those on the panel. But I'm already seeing some really fantastic comments and questions coming through in the chat. I'm here from the Childhood Bereavement Network, and the Childhood Bereavement Network, or CBN, has been calling for grief education for over 20 years. It's been something that we champion, and it's something that we really believe is essential in order to create the compassionate communities that we all kind of want to see. And I think I saw that reflected earlier in the previous session. For those of you who were able to come along to the opening session, I just wanted to say congratulations to Joan and Christine, because you were highly commended for one of the awards around the work that's been done in Northern Ireland. And it was also picked up and referenced by Patrick Vernon, who was a commissioner on the Independent UK Commission on Bereavement. And that work happened over a couple of years ago. I know that the Commission published the findings and the report on that particular piece back in 2022. And as part of that, the Childhood Bereavement Network gathered the views of children and young people, and what kind of definitely came through from that particular mini consultation with children and young people, and what resulted in a recommendation around grief education and making sure that that is embedded within the curriculum. So what CBN decided to do is to bring together a range of passionate and committed individuals. Now, I feel like I can see some of them here in the chat already. So thank you for those of you who've already come along today. It's lovely to see you. But we came together and we realized we all had a particular passion around this, but we were all bringing our own experiences, and we were all bringing and adding to the growing volume of evidence about how well this can be done. I think the Northern Ireland programme is a really exceptional piece of work that highlights overall how you can have these really important conversations in schools. But I think what Patrick was trying to say is that sometimes we need to have the important conversations ourselves. So as part of that, what we've done is we've created this group of committed people. We've created a theory of change, which aims to understand what it is that we really want to see. And our overall ambition around this is to be able to develop those compassionate communities where talking about death, dying, and bereavement can be done comfortably and confidently. But if you work back from that wonderful long-term impact, you kind of begin to see opportunities where you can influence and create some change. And one of the ways that we're trying to do that is through some legislative and policy ways. So you'll remember last year, for those of you based in England, that there was an RSE curriculum review where there was potential guidance put out for consultation. And we were really pleased to see that there was grief and bereavement was mentioned both at primary and at secondary level in this RSE draft guidance that was out for consultation. However, that consultation started in April and it finished in mid-June. And for those of you who are based in England particularly, you might be going, oh, there was something else that happened in June last year, which was our general election. So we had this opportunity to really make some noise and to really push our key messages around grief education. But because of the general election, we didn't know what was going to happen to that consultation. And at the moment, we still don't. We haven't heard anything else about what's happening yet. But then the government set out its legislative agenda in the King's Speech, and there were some ideas and there were some further opportunities that we decided to take. One of which was to again submit to the wider curriculum and assessment review that happened in England. I'm very mindful it's England focused at the moment. But that was a really useful opportunity to again highlight the fact that grief education was essential, it can happen, and it can be done really well. Our evidence is growing and growing and growing across the days. And then as part of that legislative agenda, the government also came out with the Children's Wellbeing in Schools Bill. Now, we've been doing some influencing around that, and actually we've got some amendments tabled up for discussion at committee stage today. So it's either happened this morning, which I haven't been able to double check, or it'll be happening this afternoon. This is really good. But what we did have the other week was one of our questions was tabled talking about this role of the virtual school head. So virtual school heads are designed to look after the outcomes of looked after children, a cohort of children and young people that are often overlooked. Our question was to try and extend that virtual school head role to include bereaved children. Now, the response that came back from the minister was interesting and rather heartening because, again, they referenced the importance of grief education within schools. So we are still waiting to hear what was going to happen in terms of the RSE curriculum review. We're still waiting to hear what's going to happen on that wider curriculum and assessment review, but we're not pausing. We're moving on and we're developing what we need to do to make sure that if it is included, then we're able to go out to teachers with the same level of confidence and comfortableness, highlighting when it's done well, it can really change the conversations that you're having in schools. And I think there's something else to be said around some of the other opportunities that the Childhood Bereavement Network offers. For example, we lead on Children's Grief Awareness Week. And 2 years ago, in 2023, we worked with an organisation called Votes for Schools, which creates lesson plans around PHSE or like these social and emotional topics. And we help them to create a lesson plan around bereavement. Now, what we're really heartened is that 38,000 children and young people took part in those lesson plans and school assemblies. And at the end of the week, there was a simple vote, which is, do you feel more comfortable supporting a bereaved peer than before? 81% of primary school pupils said, yes, I feel more comfortable being able to support somebody who might be bereaved. And 65% of secondary age students came back and said, yes, I feel more comfortable in supporting somebody who is bereaved. So we know the children and young people are feeling able to have these really important conversations. I think my challenge back to everybody here is I don't think we're still comfortable having these conversations yet. And so I think we need to talk to ourselves about how to talk about death, dying and bereavement in a way that is comfortable, compassionate, but confident, so that we can pass those techniques, those skills, that language onto the generations who are coming behind. I think I also could go on, so I'm going to pause there and allow somebody else to talk. Thank you so much.
Thank you so much, Gail, and I couldn't agree with you more around that the young people are more comfortable, absolutely, than us adults, because that came through very strongly in the survey of young people and kids' life and times that Christine talked to as well. Whilst they had their own degree of it, their perception of others was far higher, sky high compared to ours. And we, I think, at times project our own fear and taboo and uncomfortableness at talking around it onto young people. I'm going to go now. We will have questions, lots of questions in the chat, which is great. So keep them coming. And I'm scribbling down notes as well. I'd like now to go to Nick Matheson, our chair of the Northern Ireland Education Committee. And Nick, thank you so much for joining us today. I know you're very busy. And from your perspective, it would be really good to get your take and feedback on it, because I know we're grateful to you for your support on our work, but from a policy perspective, it'd be really good to hear your views as well. So over to you.
That's great. Thank you, Joan. Hopefully you can hear me okay.
Yep.
So I'm not on my own device, so that anything could go wrong here. When I tried to log on my own device, it didn't like it at all. So hopefully the technology will all work. So look, first of all, Genuine, I'd like to begin by just really paying tribute to the work of Marie Curie in this space. I think it's been so positive and so refreshing to see a charity that I think a lot of people sort of perceive to operate really in quite a clinical space, moving into a different area of policy and bringing all of their expertise from all those aspects of your work. And you've produced a really, really excellent piece of work, which has got like a lot of traction in Northern Ireland. I think people have been talking about this issue in a really positive way. So I think it's just important to put it on record. It's a really great piece of work. And I've been pleased personally just to see the subject of bereavement in schools and how we address it appropriately and effectively, getting attention in Northern Ireland. I think for me, I would want to maybe just start from sort of the overarching issue with all of this, and it's probably not even specifically in any political sense. It is just that issue of the taboo around speaking about death and dying, and I think it just for so many of us, it remains an issue that we're not comfortable discussing. And so I think on that basis, that really good quality education in this space is so vital if we're going to break down those taboos, so that in terms of the generation that are in school now, they maybe don't get saddled with some of that baggage and those taboos around the subject that some of us adults have. Because I think, and I could even sort of say this from my own personal experience, I think if we don't have the confidence and the language to speak about death, then when it comes to the experience in life when we are experiencing grief, we don't really know how to deal with those overwhelming emotions, or even to ask for help and ask for support. So I think breaking down the taboo, really is at the very, very crux of all of this. And I think our schools have a really vital role to play. It's been referenced already, and I think it's really important to note the young people are as on so many issues. They're ahead of us on this. They are way ahead of us on these issues. And I think from engagement at both events that have been run up here at Parliament buildings, and then at the launch event of the Marie Curie report, and for me that was the bit that was the main takeaway, is that the young people are genuinely way ahead of the adults on this. I think they're possibly not even aware there is a taboo. It's us who sometimes create that. So I think that there's certainly no sense from many young people that they want these topics to be off limits in any way. They want it to be something that can be discussed in school. So there's a whole range of things we could talk about from the education sort of perspective and from the policy end of things. I would maybe just want to draw out three things that I think are really important. I think it's a really practical thing, and it doesn't take money and it doesn't take huge departmental initiatives. I think actually the school-based policies around bereavement are really, really important. I think that if schools can have really good quality policies around bereavement embedded into the school, not something that's dusted down if there is a bereavement in the school and that maybe teachers have to figure out what do we do, but that just a genuine commitment to a whole school approach to ensuring that bereavement is dealt with sensitively, appropriately, but not a subject that is hidden in any way within the school community. Now, I think there is a role for the department and also for those operational bodies within education to upskill school leaders and boards of governors around what really good quality, effective bereavement policies look like. I think there's a role for the teaching inspectorate to ensure that those policies really are, properly embedded and being used in schools. But I think those policies can really set the tone of everything else that happens in a school, and they should be documents that everyone in the school is familiar with. I think one of the things that came out quite clearly in the research was that a lot of teachers either said that their school didn't have a policy or they didn't know, but actually it turns out that quite a high proportion of schools actually do. It's just that most people working in the school aren't aware of it and how that's given effect in the life of the school. The second, and Jackie's already picked up on this, I think this is really, really important. Teachers need to be trained and upskilled on this. There's no sense that I ever have in engaging with the teaching profession that they don't want to engage with these issues or deliver really good quality grief education, but there is definitely a sense that they maybe feel that they are not properly upskilled in this area. So that's why really good quality training resources such as Marie Curie provide is really, really important. And resource is critical on that. We don't have a lot of money going into teacher professional development in Northern Ireland, and that has been the case, sadly, for really quite some time. But if we're going to take the positives departmentally here, there has been a clear commitment to invest over the next couple of years in teacher professional development. That was an outworking of our local independent review of education and one of the clear actions on that. And I think if that is the case, that there is a commitment at ministerial level to make that investment, that this sort of really good quality education in this space would be really, really important. And then the third one that leads on from that for me is curriculum and resource. And this is a really, really tricky balance, I think, because everyone will agree in principle, yes, this is a good thing and we should be looking to do it. But then there's a nervousness, I think, among a lot of teachers, in particular and school leaders, about overloading the curriculum. And there's, an ever growing list. And I can say from, education committee perspective, there are so many different stakeholders and lobby groups who want to see different elements of, reflecting their particular emphasis and focus to be embedded in the curriculum. So I do think we need to be aware that there is a context of a big lobby to get things in there. But as Jackie has alluded to, schools have a lot of flexibility in how they deliver the curriculum. And I think when we take the time to make explicit reference to things such as grief, death, dying in the curriculum, and to really almost give that permission, you can cover this, and there are going to be resources delivered that will enable you to do that, and we will put in place the training to support you, that helps us move in the right direction. And I think seeing that embedded would be really, really, really positive. So I'll just finish because I know that Joan is really keen to keep everyone to time, and I spend most of my life chairing a committee where I'm constantly badgering people to keep their contributions short. I probably just want to finish by drawing attention, I think, to the title of the report itself, and it's that focus on compassionate school communities. I think if we start that as our benchmark, if that's our starting point, that we want to have schools as places that aren't just about delivering exam results and educational outcomes, but that really do look after the whole child with compassion at the core of that, then this is an area that we absolutely can't ignore. And I have to say, I am pleased that there does seem to be a genuine policy direction of travel here in Northern Ireland to do this well. So I think that's probably all from me at this stage, and I'm happy to hand over to the next presenter.
Thank you, Nick. Thank you for that. And I couldn't agree more as well. I think there are certain areas that we can champion. We need some catalysts, and we can champion some areas. And I think if we just harness every opportunity, whether it's formal or informal, especially in the curriculum space, you know, to shoehorn that in. There are lots of opportunities to introduce death, dying and grief. It's in literature, it's in all sorts of areas, and we actually could be doing it anyway, as well as formally getting it into the curriculum. And last but certainly not least, Sally, you've been waiting very patiently. You've got oodles of experience in this area, not only in terms of, you know, what you've been doing in Scotland with your Strathclyde hat on, but also in your European footprint. So I wonder if you could give us a bit of a reflection from both those areas, because you come with a wealth of experience which we could really learn from.
Yeah, thank you, and thanks for inviting me today. It's great to hear about the schools project and all the different work that's happening. As you say, it's over the last few years, it's really, there's kind of a lot internationally growing work in this area. And I've been involved from, I think, 2010, 2011 now, looking from a palliative care perspective, actually, in terms of what was the role of a palliative care service in working with schools to develop education and support for children and young people. And that was from a public health perspective, which really reflects a lot of the conversation so far, which acknowledges that bereavement and death, they don't just belong to palliative care. They're not medical experiences like Nick kind of referred to there. They're social experiences, and most of those experiences happen in our communities and our daily interactions with people. And what was really interesting for me in those initial days of my PhD was speaking to the young people who actually, they said death wasn't taboo. It was everywhere. It was on TV. It was when they learned about the Jacobites. It was when they played Fortnite on their computer. It was in Harry Potter. So it was a big part of their life, but there were certain spaces where it wasn't okay. And one of those was schools. They recognized that teachers often turned the page if there was a poem where someone died, or changed the subject. And because of that, that made them hesitant to engage with those topics in the classroom sometimes. And they also recognized that they were a child and that people were protecting them. And so they kind of understood why people might want to do that. Through my original research and speaking to those young people and the teachers involved in educating those young people, we came up with some innovations to address that. And that was what's been talked about here already, and that was developing a death and grief education program. It was developing a school's bereavement policy, and it was also developing training for the school teachers. And the important finding for me out of the training actually was that the teachers had the skills, they just didn't have the confidence, and it was just about building confidence with all the school staff to engage in these issues. And as I say, that was a long time ago, and I've been working with various partners here in Scotland to think about how we, develop, going from those small local projects, kind of a wider, more national approach, bearing in mind that the Scottish curriculum looks very different to what happens in Northern Ireland and England. And in particular, Good Life, Good Death, Good Grief, St Columba's Hospice have been working at developing a school's bereavement charter mark that schools can opt in and showcase that they're taking forward various aspects of work in this area, and then get a charter mark. And that's all available online if anyone that's interested. But of course, there's still barriers to taking that work forward. It's a busy curriculum. Literacy, maths often taking focus. There's a lack of policy focus. Death isn't explicit within the Scottish curriculum. It is actually there, but you have to kind of look for it. And there isn't a lack, there still remains a lack of teacher training. And I guess partly out of some of my own frustrations about thinking, how what can we do? Myself and Dr. Bert Quintians at VUB in Belgium, who is also doing some work in schools, got to get together to develop the European Learning Network on Compassionate Schools. And really that was recognizing that this type of work is happening in different disciplines. So it's kind of been taken forward by those working in bereavement, by educators, by social workers like myself, by palliative care professionals. And what can we learn from those different disciplines to what are the opportunities for building this work, but also what are the challenges? And that was only formed last year, and there's still lots of learning to be had. But I guess some of the key learning, certainly for me, has been that, you know, it's more about bereavement support than grief education. It's about changing school cultures and about the whole school community in interacting with these experiences. So that absolutely involves a lot of what we've talked about having formal policies in place, and having death in the curriculum and proactively preparing children for when these experiences happen. But it also involves thinking about just the everyday experiences. So what do you do if you're delivering a poem where someone has died in it? What's the next step to that? When you're teaching about lifespans, do you stop where the butterfly floats off, or do you think about what happens when the butterfly dies and how long does it live, and how do you have that conversation in a supportive way? But also, what do you do when someone comes and says their pet has died? And children and adults, we all learn from these experiences. It's a key part of that informal learning that can really assist in breaking some of those, what we're calling taboos. And kind of through that, what we've developed from the Learning Network is this how-to guide, which I know is in the downloads. And it's certainly not a magic wand in terms of how you develop work in this area. But what that recognises is that we can start anywhere. And some of those things do involve resource and curriculum redesign. But there's also small things that people can do if they are interested in changing cultures and using the opportunities that are already there in the school. So that exists and hopefully is useful. We'll be interested to find out if it's not. And I'll stop there actually, Joan, because I know there's lots of questions and it's not long enough.
Thank you, Sally. And you've answered one of the questions that I had anyway, and it was really around, you know, how much can be done without formal intervention on the policy level. I heard in my head there is quite a lot that can be done if we have champions who can change culture and do, you know, make interventions in their own space in schools, and we probably need to ignite more fires out there, and I suppose that's what we're trying to do as part of this movement. But just you summarised it nicely there, Sally, as well, around, you know, a lot can be done in addition to the formal interventions from a policy perspective. It's helpful, of course, and that's what we're calling for many of it, because a lot of schools and teachers want and need permission to do certain things. But, you know, we are seeing from those some examples that we're seeing on the ground here of how much difference can be made. You're on mute there.
Sorry, yeah, to pick up slightly on that, and I think Nick kind of phrased that really well about how the policy and the curriculum, you know, is a real key driver in making things happen, and a lot can be championed locally, but people move on, priorities change. And certainly in the Scottish curriculum, the key, you know, it doesn't have to be directive, but just ensuring the right prompts are there so that this doesn't get missed or go under the radar, that it has to be included in some way that's right for that school and right for that school community, and done in a sensitive and informed way. I see them very much complementing each other.
Yeah, I totally agree. I'm just going to go, I know we're really limited for time, so I'm going to go to some of the questions in the chat, and I'm going to put them to our panel members. I know that I will have an answer to these, but it's a panel discussion. I would be really keen to hear from them. So there was a question around whether support staff were involved in the training, and it was just for teaching staff. We opened it up to everybody in the school because a child will interact with everybody in the school, and that was my view in our programme. But I'm going to go to Jackie. Jackie, what's your view on that one, whether we should open it up to beyond teaching staff, the training?
Absolutely, Joan. I mean, that it's a full school community, and children will have their own members of staff, particularly the younger ones will have their own members of staff that they feel they can reach out to and trust. So it's really important, if we're going to embed it in the school culture, that all of the staff, you know, regardless of what role they play, they all are there in order to educate the children in different ways. So it would be vital, in my opinion, that, you know, all of the staff have got the confidence, and, you know, as has already been mentioned, I think the staff have the skills. They don't know that they have the skills, and they just need the confidence to bring those skills forward. So yes, absolutely.
Yes, and I think that's what we found as well. You know, children, the young people will have their preferred go-to person. May not always be a teacher. It might be the dinner lady. It might be, you know, somebody. I think it needs a whole school approach, absolutely. I've just lost my Q&A because the timer has come up there, but I do remember there was one about trauma-informed practice, a question in there. And we very much the program that we did, and I'm going to open it to the panel. The program that we did it didn't come from the trauma-informed space, because we do have a critical incident service that sits within our education authority. We wanted this program to be far more generic in terms of opening up the discussion around grief, loss and bereavement. And we did use the organisation that Gail referred to, Votes for Schools, and did a lesson plan that we used in the curriculum as well. And that was wider, and to answer one of the other questions, that was wider than bereavement. It was loss. It was loss in its widest sense, like loss of a pet as well. But the program is really around opening up the conversation so that children who were bereaved would get the support, but children who were not yet bereaved would also be able to support each other. And, you know, it was peer support. So I wondered if there's any of the panel members want to come on the back of that question and give a view.
I
Gail?
do, Joan.
Yeah.
Thank you very much for that question, because I think it's a really important one. And I just want to highlight the work of the UK Trauma Council, which is part of the Anna Freud Centre. So the Childhood Bereavement Network collaborated on a piece around traumatic bereavement specifically. And if you go to the UK Trauma Council's website, you can download resources for schools and community organisations to be able to support those who have faced a traumatic bereavement. They've done further work around those children and young people who may be arriving in this country with previous forms of trauma, for example, as well. And then there was only one other one that I wanted to highlight as well, which is that War Child has also done some work around that. And I know Barnardo's in Northern Ireland also did some really fantastic work with War Child. The UK Trauma Council also has some guidance that schools can follow if there's been a critical incident at a school. So there may not have necessarily been a death, but there may have been enough concern or fears or a really key or critical issue that may have happened. And I'll pop all of those links in the chat under Joanne's question so you can have a look. Thanks so much.
Thank you, Gail. And I literally have a few minutes to wrap up. But I will say there are lots of questions that were very specific in the questions there that we can signpost. We will make sure that you all have links to the website. We have materials on our website, and we'll make sure that we can also signpost you to other sources of materials like Gail has mentioned there as well. I want to, there was a question there at the bottom about existing models of working across health, education and social care to co-produce educational resources. Well, I certainly hope that we will be doing that in the Northern Trust in Northern Ireland. We can see everybody's joining together now in terms of public health and education, and it's very exciting, and also the community and voluntary sector. So that will hopefully be another resource that we'll be able to share with you. I'm very conscious of time, so I am just going to say thank you all so much for joining today. Thank you as well to, and I will call you experts because you're experts in your area, although you don't all agree with that. And it shows as well, you know, the synergy in the room of all the different areas coming together and of us learning and sharing best practice. I really appreciate you taking the time, especially I know that many of you are very, very busy. I am making a commitment to respond to the queries in the chat as well, because we should be able to answer most of them. And they were fairly, they all came up in our training, and if they came up in our training and our programme, they will come up in all the other brilliant models of best practice that are in existence out there. So I hope you enjoyed the session, and thank you so much for joining us, and hopefully watch this space.